think it's 10 seconds. We are live. So a very good evening to all the students who have joined us here. If we are audible and visible, just say a yes or something in the live chat and we can take on the session. Are we audible and visible? Yes, we are audible and visible also. So good evening, everyone, all the students, all the FMG aspirants who have joined us for this session. It's my privilege. I'm Dr. Sandeep Sharma. I am the pediatric faculty for NEET PG and FMG at DocTutorials. And it is my privilege to bring to you, to all of you students, some eminent faculty members across all the 19 subjects. We are here to motivate you. We are here to share some last minute advice, some blueprint, and some topics not to revise relevant for your exam. If you are going to sit in the next 1 week and you are in a conundrum, what you are going to focus on and what you are going to revise in a particular subject area, that is what we are going to focus in this subject, in this live session. At the same time, we are not going to make it too complicated, too lengthy for all of you. We'll keep it very brief and to the point. So I welcome all the faculty members. Welcome, sir and ma'am, to the session. Okay, so I will be first of all starting with Dr. Naveen Porwal, sir, because when people will be sitting, before I start with Naveen Porwal, sir, just a disclaimer. Some of the faculty members, they had prior commitments. Some are stuck in traffic. So some of them have joined us now, and some of them will be joining in the subsequent course of this live session. So just don't go away, right? So we'll be starting with physiology, and Dr. Naveen Porwal, sir, is here, the eminent physiology faculty. Sir, I would start with asking you two queries. Number one, if someone is weak in the FMG exam and he has just 1 week to go, what are the sure short topics you would advise the student to have a look to get that boost in the exam? And secondly, any particular message from you to the students? Naveen, sir.
Yeah, good evening, sir. Good evening, everyone. So, of course, sir, I have seen that often repeated MCQs and repeated topics are coming almost for last 5 years, in which one is like ventilation perfusion ratio. When it is infinite, when it is zero, then one question is sure shot coming from jugular venous pressure. And then, sir, I have seen that Vigor's diagram. Even if you don't remember the cardiac cycle, if just we know have a glimpse of Vigor's diagram, when there is a right shift, when there is a left shift, all these are coming almost. We can see every year one or two questions are there, sir. And what I see the recent trend is that about the heart block, especially the MOBIS 1 and MOBIS 2. So they are alternating asking about the MOBIS 1 and MOBIS 2. And then, sir, they are asking, for example, glucose transport, glucose absorption, SGLT oblique glut. So SGLT1, SGLT2, and glut, and they are linking, they are integrated with the pharma also. They are integrating the question like, for example, SGLT2 blocker drugs, canagliflozin, dapagliflozin, like that. For example, they will give that one drug is given in the patient of diabetes and it is blocking which channel. So like that, they are asking. And from kidney, the most important chapter is pH, buffer, like bicarbonate buffer, and those buffers are they are asking, especially the compensation part. And in the sensory, if I see, sir, they're asking questions from outer hair cells, inner hair cells, and especially the vestibular apparatus, like semicircular canal, and then like utriculus and ventriculus, then the lesions of the basal ganglion. So these are the topic which I have seen. They are coming very, even if they don't know anything about the physiology and have only 1 week, and they have to revise the topic, so at least they must revise these topics. And
Great,
the last thing is that at least the minimum thing is that they should do at least 10 year last year FMG papers.
Great, sir. Great, sir. So all the students, please take note. This video after the live session is over, it will also go up on the DocTutorials YouTube channel. So you can have a look at, if you missed out on something, just make a note of the points and don't miss out these points in the last week and do them along with the previous year question. Don't try to read something new at this moment. So after physiology, there is an applied part of that. Applied part, obviously, the biggest subject, the toughest subject of paper B, that is medicine. So we have our eminent medicine faculty, Dr. Rahul Rajiv sir, with us. So Rahul Rajiv sir, what are the areas last 1 week FMG students should be focusing in medicine, and any additional advice you want to give, sir?
Yeah, so good evening, everyone. So, coming to the point quickly, dear students, as you all know, medicine is a vast subject. So, I'll just quickly take you through some important topics. And I'll just list down two important topics from each of the modules, maybe three from certain topics. Cardiovascular system, heart sounds, JVP, and I would suggest you to go through the ECG part as well. We have already done a session for you in the QRP part. So just go through the ECGs, at least of the tachyarrhythmias and the ECG changes in hyperkalemia. And recently, last time they had asked about WPW syndrome. So just go through those topics from cardiology. From neurology, Parkinson's disease, important, and also the management of stroke, respiratory system, pulmonary embolism, tuberculosis. Do not go to the exam hall without reading tuberculosis. And you can expect questions integrated from PSM as well. COPD, like you can get some pathology interlinked questions as well from emphysema. And occupational lung diseases, I think important, especially asbestosis, silicosis. So please go through that as well. Rheumatology, SLE, rheumatoid arthritis, and ankylosing spondylitis. National board examinations need PG and FMG. I think ankylosing spondylitis is often asked, especially the radiology question of bamboo spine. So you can expect that as well. From nephrology, you can expect questions from chronic kidney disease. Maybe they might ask some of the other nail findings or some clinical scenario asking about the indication for dialysis, something like that. Then about autosomal dominant polycystic kidney disease is also a favorite topic from nephrology. And Good-Pasteur syndrome. Mind you, Good-Pasteur syndrome, very important. So for that matter, vasculitis per se is an important topic, along with rheumatology, I'd like to mention vasculitis as well, because you can get questions interlinked with pathology as well. Okay. And then so I've covered neurocardio, GIT, peptic ulcer, inflammatory bowel disease, very important. Peptic ulcer as well as inflammatory bowel disease. And coming to the hepatology part, Wilson's disease is very important, and hemochromatosis, and some basic simple questions on chronic liver disease, cirrhosis you can get for your exams. And you also please go through certain topics where medicine is interlinked to pharmacology. You are likely to get questions from either anti-epileptics, antiplatelets, anticoagulants, antipsychotics, and antiarrhythmics. So I think there are likely possibilities, like you might be asked a question on amiodarone. So these are the questions that you can expect interlinked from pharmacology as well. So these are the most important topics. I would just say that you can just quickly brush through in the last one. Okay, and I just want to tell you that don't panic too much. The topics are vast, but I'm sure that you have put in genuine amount of effort in the last several months. So remember, it's an MCQ exam and not a theory exam. You will have four options, and one of that is the right answer. So just stay cool. You have already studied, you have revised, and I'm sure that if you keep a calm, cool head, you will be able to answer well during the exam. All the best.
Very aptly said, sir. So please note down all the topics which Rahul Rajiv sir said in medicine, because medicine is huge. So just make sure that you go through these topics and get that confidence in the exam. So after medicine feedback, we'll be moving to that subject on which number of questions in every exam, whether it is FMG, NEET PG or any other exam, the weightage is rising. So that is forensic medicine and toxicology. So for forensic medicine, we have our ever affable JP sir with us. So Jayaprakash sir, welcome to this interview, this live session. And sir, your views for the students appearing in the exams.
Yeah, good evening, everybody. Actually, there is nothing much to speak about. Anyway, what are the important topics I'm going to post in Doctor Telegram group? But telling briefly, identification normally what they ask about the evidence as well as perjury. Thanatology normally they ask about marbling continuously and adiposity. Toxicology most important is regarding the snakes, datura, cocaine, and organophosphorus. And sexual jurisprudence, usually they ask one question from medical termination of pregnancy, the recent changes, and regarding rape, the laws on rape. Nothing to worry about the Bharatiya Nyaya Samhita because It has not been implemented as of today, but it will be implemented only from December. Now we have to think about few important IPC only, nothing much. And in case of mechanical injuries, always you should know about the how to differentiate between different injuries, right from chop wounds, lacerated wounds, then self-inflicted wound, defense wounds, also things. All these images you have to see properly. At the same time, firearm injuries, you should know what are the various ranges, how the pitch, this wound of entry differs. But anyway, now there is no fun in telling because there are only a few days for the examination. You cannot revise. What I say is, what I suggest you is, whatever you have studied so far, you have to only revise. Don't start with any fresh topic. Whatever you have studied so far, whatever the material you have studied, same thing you have to revise fast, 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 fast. Okay. And most important is, most of the time, students always say after the exam, oh, I have done silly mistake, silly mistake, silly mistake. Don't do silly mistake because time will be there anyway. You read the question properly, then rule out the option, then you go for the correct answer. Okay. And most important is you have to sleep properly in the night, means in the previous night, not after the exam. After exam, anyway, you have to sleep. And previous night, you have to sleep very well. And as you know very well, maintaining the compos mentis is very, very important. You should be very, 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 very cool. You have to should not take any stress at all. Okay. Wish you all the best. Bye bye.
Thank you so much, sir, for your wonderful motivation as well as important information for the students. Now we'll be moving back and forth. Let's move to paper two, the bigger paper, and another big subject over there from where questions, a lot of questions are asked in FMG exam is obstetrics and gynecology, and we have Gayatri ma'am with us. Ma'am is a product of AIMS Delhi. She has been a topper all through her life, and she's like, the rising star in the world of obstetrics and gynecology. So for many of you know her already, and many of you, when you see her videos, you would realize what a wonderful educator ma'am is. So ma'am, your feedback on your views on what are the topics students should be going through before they sit in the exam in last 1 week. Ma'am, you're mute, I think. Please turn on the mic.
Thank you so much, sir, for the very kind introduction. Hello, everyone. So I know you're all tensed at this point of time. There is a lot of revision going on. So I won't be giving you a very extensive list so as to study now. So I'll keep it very simple. Previously as well, we have discussed nearly 10 to 12 topics from obstetrics and gynecology. You can find that in my Insta page as well. But now I'll be just giving you five topics each from obstetrics and gynae, which you must know. One is antepartum hemorrhage. Always there is a question on antepartum hemorrhage. Mostly it is on abruption. They give you a clinical scenario and ask you to find whether it is abruption. Sometimes they confuse it with uterine rupture. So you have to know thoroughly about antepartum hemorrhage, how to differentiate placenta previa and abruptio placentae. Next, a very important topic is abortion. So you know that the MTP amendment has come up, and there has been in each and every paper, there has been 1 or 2 questions from this topic. This is a must know. What are the changes that came? What is the medical surgical management that is being used? It's a must know. And in the last paper, there were nearly 2 to 3 questions from this topic. You must revise to it. Ectopic pregnancy. So you should know, next is ectopic pregnancy. You should know the brief management about ectopic pregnancy and briefly about anti-D as well. When will you give anti-D? What is the dose of anti-D that you are going to give? Next, coming to the medical disorders, I will tell you to focus on hypertension and diabetes. Specifically, there have been many questions in the screening of diabetes. You should know about the screening. How are you going to manage them? So as I taught you as well, you just try to divide it as GDM and overt, then go for the further management. So you should know these 3 things from diabetes. What are the screening methods? How do we divide them as GDM and overt diabetes? And how are you going to manage this patient? From hypertension, if I say 3 most important things, one is how will you classify the 5 types of hypertension? Second is how will you divide it as severe, non-severe? Finally, briefly about the management. In the PPH, always there is some question about the medical management of PPH. So you should know about the important drugs in PPH, and there has been question that is shifting towards mortality as well. What is the maternal mortality, direct, indirect causes of mortality? So these are the 5 most important topics of obstetrics. Now coming to gynecology. So in gynecology, first I will tell you to stress on amenorrhea and the sexual development. In amenorrhea, there have been multiple important topics like the imperforate hymen, androgen insensitivity syndrome, and MRKH. These are the most important 3 topics that you have to concentrate from amenorrhea. Next, from contraception, again, you have to briefly know about the intrauterine copper devices, the barrier methods which are available, the implants, as well as the DMPA injections. A brief note, just have it go through the contraception. CA cervix, I cannot emphasize enough on the topic of CA cervix. Must know about the management of CA cervix. When will you give radiotherapy? When are you going to do the surgery? A very, very important topic is CA cervix. There has been rising number of questions from CA cervix. If at all you miss everything from CA cervix, and you must know about the screening and HPV vaccine. These are the must know from those topics. Coming to the general gynecology, 2 very important topics are endometriosis and adenomyosis. So again, from endometriosis, there have been various clinical scenarios where they will be giving you nodularity in the pouch of the egg, like so many clinical features of endometriosis. And usually it's a clinical scenario that comes from endometriosis and adenomyosis. Finally, coming to the 5th topic in gynecology, it will be genital infection. Very easily you can answer all those questions if you just go through the table how to differentiate the 3 very common type of genital infections. That is the bacterial vaginosis, the trichomonas vaginalis, and candidiasis. These are the must 5 topics from OBS and gynecology. So again, I'll post this as well so that you can go through the list once more. So again, all the very best for the exam, please. I know you might be in a lot of stress at this point of time. Please understand that it's not possible for anyone to complete 100%. That's not expected of you. It's never ever possible. So even if you have not finished everything, don't be very hard on yourself. Understand that that's normal for everyone. I have never seen someone saying that I had completed everything, I finished everything, that's why I got this rank. That's not possible. You did the best which you could do, and you have these last final days. Give your maximum in this time and believe in yourself. Understand that once you believe in yourself, you have that confidence, it actually creates miracles for you. So believe in yourself. I'm sure that you can do wonderfully well. All the very best for the exams, and keep on revising.
Thank you so much, ma'am, for wonderful guidance to the students. If you feel कि OBG is going to be very problematic, please have a look at the topics which ma'am mentioned. But don't try to read everything and cover to cover. Time is not left. Just try to touch every important subject. Moving on to the next subject specialist. Sir, बहुत सारे comments आ रहे हैं. Nadeem sir, why are you so silent? So, sir, time to break your silence and share your views with the students.
So first of all, good evening, everyone, all the senior mentors and all the medicals who are here. So before I speak on my subject, first of all, I would like to emphasize on those topics which I'm getting on my phone call, sir. First of all, recent update is that your admit card will be issued on 15th of January, first of all. After that, the phone calls and the messages what I'm receiving, sir. Okay, sir, I'm having so much anxiety, so much shivering, palpitations, and fear what to do. My dear friends, everyone will be having the same thing. This is 100% natural. If you are not getting palpitation right now, then it is abnormal, I'm telling you. Right? So this is 100% natural as you are going to write one of the most difficult exams in your life right now. So the most important thing is how to control this, how to balance it. Simple thing is that you cannot do anything new. You cannot do anything new, only 7 days left. But you can do wonder, you can do great. How? Please don't run behind 19 subjects. Revise only the strongest subjects of yours. I'm sure you would have done great in 14 to 15 subjects, right? So I'm not asking you to run behind 19 subjects, right? No, only 14 to 15 subjects. Remember here, if you are going to do great revision in last 14 to 15 subjects now, see, in this manner, what you can achieve, you can increase the accuracy of marking the right answer. And you can increase their score. Remember, how much you have done in last 6 months, that is a separate part. And how much you are going to revise in last 7 days, only this is going to decide your destiny, I'm telling you seriously. Because you will be able to recall only the fresh knowledge with 100% accuracy. Right now, so in this manner, you are going to increase the accuracy by marking the right answer, I'm telling you. Fine. How only 14 to 15 subjects? But revision should be very, very fast. Don't go into the deep of any topic now. You do not have enough number of days now. Only most important topics from every subject. So this should be the most important point which you should be keeping in the mind. Regarding my subject, I will say that these days, most of the questions they are asking from psychopharma. See, especially all SSRIs, right? SSRIs, SNRI. After that, mood stabilizers. Or lithium, lamotrigine, valproate. They are asking the side effect of valproate also. So psychopharma, most important. Minimum 4 to 5 questions you can expect. Recently, they have launched, one new drug got approved in August, 4th August. Newest drug for the postpartum depression, Zurzuvae, Zuranolone. This you have to keep in mind. All the new drugs, you can anticipate the new question. And apart from that, related to 100% psychiatry, PTSD, panic attack, schizophrenia. How to diagnose the schizophrenia? Keep in mind, suppose if you are getting bigger question, right? A very, very big question in psychiatry, multiple symptoms, right now. If you don't know the exact answer, if one option is schizophrenia, please mark it. 100% it will be correct. Because in schizophrenia, there will be more than one symptom. More than 1, 2, 3, 4, 5, 7, 8 symptoms can be there. So one answer pakka, 100% sure. Apart from schizophrenia, yes, PTSD, panic attack, bulimia nervosa, anorexia nervosa in the eating disorder, and delusion and hallucinations. So these are mostly, I would say, most anticipated topics. And like in last days, I would say, how much you have done before, so do it fast, right? I wish you all the best. And obviously, you have so many great mentors here. So I'm glad to be the part here. Thank you so much, sir.
Thank you so much, sir. I keep repeating, students, if you have joined late, please mark this video एक बार जल्दी से 1.5x में दोबारा just listen to the video again, because whatever all these faculty members are saying, they have spent a lot of time in segregating those topics which they feel have a high yield rate, strike rate in the actual exam, right? So please utilize this video appropriately and just try to see it once again after this goes up on the channel, so that कोई subject अगर आप revise कर रहे हो एक बार देख लो, just listen to it once, that these areas, these topics are not missed out. Let us move to the next subject now. Students have been asking about orthopedics, and Rohit sir, you have quite a few fans asking about you in the comments. Sir, orthopedics, what are the areas one should be focusing, and your views and general advice?
Thank you, sir. And very good afternoon, good evening to all my dearest students. I'll just quickly tell you the 5 most important or the most often asked areas in orthopedics. I don't think you have to go through the entire orthopedics, just focus on these 5 areas. That would be more than enough in the last week of your exam. See, the first and most important is bone tumors. Every year you get 1 or 2 questions from bone tumors. You can have questions either clinical vignettes or x-rays for identification of osteochondromas or fibrous dysplasias or osteodosteomas, Ewing sarcoma. So these are the most important ones. The second topic would be metabolic bone disorders. Even in metabolic bone disorders, the most important would be rickets and osteoporosis. Rickets, again, very, very important in orthopedics, in pediatrics, as well as in biochemistry. Every year you get questions from rickets. You need to be thorough with the alpha till omega of rickets. Very important. The third topic would be nerve injuries. All the peripheral nerve injuries, median nerve injury, how they manifest, what will be the deformities, what will be the splints used. Very, very important. Median nerve, ulnar nerve, radial nerve, and brachial plexus injuries. You need to be thorough with. And again, there are various tests which are needed, which are done for various nerve injuries, such as CAR test for ulnar nerve injury. So all these tests you must be thorough with. The fourth topic would be your splints. Every year you get a picture of a splint and they would ask you to identify it. Usual splints they ask are your Cock-up splint for radial nerve injury, or a knuckle bender splint, or a Thomas splint, which is used for femur fractures. So these kind of splints, you must learn how to identify these splints from a picture. Then finally, in traumatology, you can have random questions from various fractures, but the most often asked area would be the complications of fractures, especially fat embolism syndrome, or you can have your deformities Either they will ask you to identify a cubitus varus or a valgus. So all these deformities you need to know. And then you have non-unions and compartment syndrome. So 5 areas in orthopedics, these are must know for your exam. These are the topics. I will not consume much time. All the eminent faculties have already told you what are the important things you need to do for your exam. I just hope and pray that you have a wonderful year ahead. And I hope and pray that all of you listening to me score more than 150 this year. Okay, thank you.
Thank you so much, sir, for the kind advice. And with this, we come to the subject of anesthesia. We have the anesthesia faculty, the brilliant Dr. Ashish sir with us. And Ashish sir, a lot of students have a tendency to leave out anesthesia, but as we have seen, there are a lot of questions these days being asked, not only on the traditional anesthesia part, but also on the resuscitation and the CPR related parts. Sir, any views, any suggestions for the students, sir?
Thank you, sir. 100% what you said is exactly the point. Talking about anesthesia, I would say you just spend 1 hour on the previous day. That will be my simple take-home message. The topics, I will say, please look on to the revision video which we have done on YouTube. Essentially talking about the topics, first one is about the airway, the Mullen-Petty classification, and the Cormack and Lehane. You will definitely going to get one question on that. Over last 5-6 years, at least one question once or twice it has been repeated. So please look on to that. Then regarding clinical things, IV cannula is one area where you will definitely get a question. Either it in pediatrics or it in adult. One question in IV cannula is for sure. And as sir has rightly mentioned, CPR is one thing which you are 100% sure to get a question. So write it from the sequence or the drug involved, especially adrenaline, the dose of adrenaline, things like that is, if you take a last 10-year question paper, 5-6 times it has been repeated. So no, never to leave a resuscitation part of it. Pneumothorax and tracheostomy is another area where you will definitely get a question. And then talking about the drugs, 4 drugs, just remember, one is propofol, another is thiopentone, third is naloxone, and then flumazenil. If you take 4 of this, one question you can get. Regarding machines, one is cylinder, pin index is one question which you are going to get. And other aspect of a device, endotracheal tube and an LMA. Of these 2, one is sure. So if you take in together, 6 to 7 question is what you are expecting. And if you don't have time to revise, just spend 1 hour for the topics which we have suggested. We have done the DocTutorials have done it nicely. Many times it has been revised. We just go through the subjects which we have revised, not only in anesthesia, all other recall sessions are going to yield you very good results. So as everybody has mentioned, this is not going to be a very, very tough thing. It is, you have got adequate data, you have adequate time. Please be cool and go ahead with that. And may God bless you, all of you, with brilliant results. Thank you.
Thank you so much, sir. Sir has very clearly mentioned the topics which students should not miss in the subject of anesthesia. Every subject matters, every question matters. So please don't leave anything untouched in the last 1 week. Just touch every aspect. Moving on to another subject from where questions have increased in the recent years, that is dermatology. We have our dermatology expert, Pallavi ma'am with us. Ma'am, your views, topics students should not miss, and anything additionally you want to add, ma'am.
Hello, everyone. All the best for your upcoming exam. The only thing I will tell you is do not miss out on the previous year questions. Every year, 8 or 9 questions that come from dermatology are all repeats. There is no new question that has been asked. So my first and most important thing would be do not miss out on revising the PYQs in the last 7 days, and don't try to rote learn the images. Go through the revision video so that you also hear about the image as you see the photo. Don't just go through the PDFs in your phone and in your Telegram groups, because that does not retain in your mind. If you just put on a revision video that we recently did in December on 1.5x or maybe even 1.75x, as you hear the names of the diseases and you revise the images, you will be able to recall it much better in the exam. Now, Coming to the important topics, I would say the most important topics are alopecias, including alopecia areata and trichotillomania. Then I would say the next topic is the bacterial infections, where impetigo, follicular pyodermas, and erythrasma. In the viral infections, varicella, hand-foot mouth disease. In the fungal infections, it would be tinea, pityriasis versicolor, and subcutaneous mycosis. Very simple questions. Just go through the revision video. All of these will be done. Then syndromic management of STDs is very, very important. There is at least one question on this every year over the last 5 or 6 years. That makes it one question every exam. Now, psoriasis, lichen planus, then the eczemas, the melanocytic nevi and the Becker's nevi, and lastly, it would be the nutritional deficiencies, pellagra and acrodermatitis enteropathica. That's it. I have given you like close to 12 topics. Out of this, 8 questions are sure. Isn't it, sir? So 8 questions are sure out of this. If you just revise this and go back and see the revision videos, that is my dictum. Don't read anything new. You've read it all. The game in the exam is to revise it and to recall it. So just revise. पढ़ा हुआ है, सब पढ़ा हुआ है तुमने.
Thank you so much, ma'am. Ma'am has made it so clear for you कि अगर नहीं समझ आ रहा भाई ये पढ़कर चले जाओ. Ma'am is taking, responsibility in a way because see, all of us, as I said, we have spent a lot of time before we came to this session so that you get, instead of randomly reading something and leaving out something, at least ये पढ़ के जाओ. If it is a atypical paper, nobody can predict about that. But what we can prepare for is the way it is being asked, right? So let's move further and let's talk about the subject which forms probably the biggest bulk of the first paper, where you get a lot of visuals also. And who else who's better than Vandana Puri ma'am to guide you? Yes, it's pathology that we are talking about. So Vandana ma'am, welcome to this live session, and please share wisdom with the students, your suggestions for the subject, ma'am.
Thank you so much, Sandeep sir, for such a nice intro. But as you all know, all the teachers here are the best teachers for the FMG examination, and they have been not only for FMG, for everything, for NEET PG and INSET, but they are the best mentors here. Okay, so they have given you the most probable areas from which the questions can come. So I will also try to do the same, and I would like to tell you the most important areas from which majority of the pathology questions come. See, for an FMG exam, I think there are core areas. मतलब मैंने जितने भी पेपर देखे हैं, most of the questions come from repeated areas. Areas, I will say, not say questions, repeated areas. So we can divide those areas into 5 basic areas like general pathology, hematology, systemic pathology, blood banking, and techniques like instrument stains. Okay. So in GPath, majority of the questions basically focus on apoptosis, chemotactic markers, majority of the hypersensitivity reactions, and in transplant, which type of transplant is it? Acute में क्या, chronic में क्या, isograft क्या? So these are the core areas. And some genes. अगर कोई exam को tough करना है, तो they can just ask ये कौन सा tumor suppressor gene है या कौन सा oncogene है. So till that, mostly they will not go more into depth in GPath. When we talk of hematology, so majority of the questions which are coming in the recent exams are basically on anemias, and they ask you very simple questions. Iron deficiency anemia का iron profile दे देंगे, megaloblastic anemia की image दे देंगे, and they'll ask you that what can be there, or hemolytic anemia का faces दे देंगे, and they can ask you that which type, what is the next investigation. So you have to always remember you have to write HPLC as a next investigation. So in anemias, they predominantly asked on three common anemias, basically iron deficiency, megaloblastic, and in hemolytic, they are predominantly focusing on thalassemia, in which they'll ask next investigation, or sickle. Recent questions were on sickle cell anemia, and when again the question was what is the next investigation? It will always be HPLC, hemoglobin HPLC. So that's what RBCs. In WBCs, majority of the time they ask you on leukemias. In leukemias also, क्या पूछते हैं majority of the time? So either they can give you a question, अगर बच्चा है और lymph nodes दिए हुए हैं और blast आपको दिख रहे हैं, तो आपको पता है वो BLL है. अगर mediastinal mass दिया हुआ है, blast दिख रहे हैं, तो usually TLL है. अगर आपको 25 to 40 years में दिया हुआ है and और rods दिख रही हैं, तो आपको पता है AML है. ये क्वेश्चन भी very commonly asked, कौन सा AML is associated with DIC? Very frequently asked question, APML, acute promyelocytic leukemia. So they will focus predominantly on leukemia. Lymphoma mein, they can ask you Hodgkin cells and they can ask you Burkitt's. These are the two favorite questions that they ask you. So focus on that, especially the mutations of the Burkitt, they'll ask you. In platelets, they don't go into much except one, ITP. Never forget ITP. Okay, so they can give you large platelets हैं, patient bleed कर रहा है गम से, so क्या हो सकता है? So that's about in hematology. Now coming to the systemic when they don't go into detail in pathology, just 4 main areas which you have to focus is kidney, especially differentiating between glomerulonephritis and nephrotic syndrome. In heart, don't miss heart. Okay, in heart they'll typically ask you about endocarditis and about all the types of cardiac tumors they can ask you. Then in so we have talked about heart. In GIT, they will usually ask about malabsorption. Like last time, there was a question on celiac disease, anti-TTG positivity, kisme hoga? Malabsorption and polyps. Okay. So in systemic pathology, they'll not go much into the details. So you have to just focus on few areas. You have to know the core areas and you have to focus on that. Okay. Apart from that, the fourth is blood banking. In blood banking, basically you have to focus on majority of the time. They'll ask you transfusion reactions or they'll give you an instrument like platelet agitator दे दिया. What is the instrument? कौन से temperature पे रखते हैं? तो temperature of the bags. And the last is the stains and instruments, guys. So stains and instruments में basically they'll give you very commonly asked stain. They'll not go much into detail, but especially they can ask you a technique like flow cytometry की picture दे दी, fish की picture दे दी, क्या है? Or they can give you a simple stain like PAS या fungal hyphae दिखा दिया, तो silver methamine. So just that much. So these are the core areas. I think if you revise these many areas, I think you should be able to crack majority of the questions in pathology. So these are the core areas जो आने ही चाहिए. You should not miss it. So that is what I think you should be doing. And rest you all know you have revised so well. So obviously you know well. All the very best for your exams, right?
So students, please note down whatever points ma'am said. This video, I keep repeating, this video will go up. Don't miss out this video. Add it, listen to it again, whatever subject you are going to revise. Have a look at that particular part of whatever that particular faculty is saying so that you don't miss out on the subject topics which the faculty members have mentioned. Moving on to the subject in which a lot of integration happens, a lot of visuals come, and the paper finds its way not only in paper B, but also sometimes in paper A, we have the subject of radiology. And for radiology, we have Khalil Ahmed sir with us. So Khalil sir, students are waiting for you to share your wisdom. Someone should focus on what parts of radiology in the last few weeks, sir, and any general advice, sir.
Yes. Good evening, and I know this must be a much stress time for all the students, but at this point of time, it is not important to focus on the day of exam or on the results. Just see that you give a good ending to whatever efforts you have done so far. See that you justify your revision. आप इतना सोचो, have a control that okay, I have studied so much. Let me end it with a good revision. So focus only on that. Make a plan for the next few days and try to, even if you achieve 70% of that, I think that's a good journey, a good ending to the effort that you have started from July. And please focus on that you should end this on a good revision note rather than worrying on the day of exam or the results. As far as radiology is concerned, like I'll go from top to bottom so that you can remember what all important things are there. The first and foremost is stroke imaging. Please go with the protocol of stroke imaging. It's very heavily tested. How to identify hemorrhagic stroke, how to identify the infarcts. Then look at the types of bleeds that are there. The regular ones, the epidural hematoma and the management of it, like subdural hematoma, subarachnoid hemorrhage, and some fancy signs that you have there, right? The panda sign, the hummingbird, and you have your Mickey Mouse sign. So those things, simple things. But important is your bleeds and your stroke image. Then coming into your thorax, two important emergencies. So in radiology, the most important will be emergencies part. Aortic dissection, right? Pulmonary thromboembolism, pneumothorax, pneumomediastinum. You cannot miss these images. In the foreign body in a child, again, the coin and the button batteries, do not miss them. In the abdomen, look at the emergencies that you come across, the intestinal obstruction, the volvulus images, the images of pneumoperitoneums, right? So don't miss out on that. Examiners have a fancy towards uroradiology, giving IVP images, horseshoe kidneys, and also towards your HSG images. So do look at those images. don't miss out on this. So most of your radiology will be pretty much doable, especially if you focus on the emergencies when you're reading or revising your final time. And just stay calm. It is, I know it is a time where you feel that you will not remember, but trust that, when you see the question with the options, your recall that is going to come on the day of exam will help you solve. And you have done so many tests and discussions now, you have done so many exams, so much of work is already gone. So it feels like that because you have not done revised recently. So it may feel like that you are not remembering it. But once you see the questions and with this good 1 week of time that you have with you, if you can really focus, you will have a good exam on the day of exam, and you will be happy and proud to see your results also. And I'm sure that you will have a good exam. All the best. Have the belief in yourself, and stay blessed and have a very, very good exam.
Thank you so much, sir. Thank you, sir. Thank you so much for the nuggets of wisdom. And please note down the topics which sir said. And eventually, moving forward, now as many of you are asking in the comments also, Rajiv sir, a lot of people are sharing for your uh, nuggets of wisdom. And sir, a few of them have asked you also, sir, why are you so silent? Along with Nadeem. Sir, please break your silence.
No, I was hearing everyone. Good evening, everyone. And what is right now in my mind, actually, while hearing this all, beautiful, advices from every faculty. Number one, I'm proud to be a member of this team, actually, everyone over here is so aligned, so dedicated to work for the welfare of foreign medical graduates. Actually, that makes me very happy. Number two, after Goa, we are like together like this again on one screen, which is giving us very like happy thing. And third thing is that, we are very happy that we are able to contribute, 1 cent to your preparation in one or other way. So this is what my feeling is at this moment. And at the same time, I would say, as we are proud of becoming part of your journey, I would request each one of us hearing at this moment to be proud of whatever they've done in the last couple of months. See, the problem is whenever we evaluate ourselves, we always look at the days we wasted, but we never look at the days we invested actually. We are the people, like I remember my medical college. I think, in the whole medical college, 5.5 years, whatever we study, the number of hours, actually these 5.5 months, number of hours will be more than those 5.5 years. So it's a human tendency to look at our negatives more because we are very self-critical people because of schooling we are probably. I think that's a cause. But please be proud of yourself. Please respect yourself for the hard work you have done in all these months. Actually, we know that what kind of sacrifice it is to sit from 9 o'clock in the morning to 9 o'clock in the evening. And if Nadeem sir is taking class sometimes 3 a.m. in the morning, still after that, next day you come to the class with a smile on your face again to learn. Believe me, it needs a lot of dedication, and that's why you should respect yourself. I understand that, we get a feeling that I wasted a couple of days. I could have done better. But you know what? We are humans. And humans to us is human, That's why these quotations are there. Every human has got some tendency to be weak at couple of days in certain, days of the months. We are not really great every day, and we should not be. So, guys, do I deserve to pass? Because that's what our question, bubbling question in our mind is, hoga ke nahi hoga? Because that's what they. Let me tell you, because this is my 26th FMG examination, I can tell you, we deserve to pass. We deserve to pass. Yes, we are not 100% prepared. Agreed. That's okay. But whosoever passed before us in the previous examination had a similar kind of feeling of inadequacy, still they made it. If they could make it, we can also make it. The important thing is why we are here together today on the platform of DocTutorials actually, because we understand the importance of last 1 week. और ये जो last 1 week आपके सामने है, there's Dr. Sandeep put a message, beautiful message in the YouTube chat also, that don't do 100%, do 200%. People say slow down in last 1 week. I'll say whatever you will be able to see in these days will be fresh in your mind. There's a high chance when you see this question, you would be able to, mark it correctly. Nadeem sir gave beautiful hint of schizophrenia. You know what? If you keep that in mind, you never know. We score 2 marks extra and we pass the paper like that. These kind of small, steps would really, make us go way beyond 150. Guys, if you are having this feeling, 12 subjects are nicely prepared. 3 are moderately okay. 2 are okay, and 2 are horribly prepared. Believe me, you're on the right track of passing the examination. If this is what your state of mind is, let me tell you, you are on the right path to pass examination. I always say one thing. I accept that I do not know everything about everything, but I know sufficient enough to pass the examination. In last 1 week, let us see the high yield areas of my notes. And this session is beautifully carved out. Every faculty member has given you a list of the important subjects, not topics, not to be missed from that subject. Please make that list and do those topics certainly, because this is actually the wisdom of all these faculty members which is being shared with you. And believe me, it's a very, very important video to be very understand. Dr. Sandeep saying, please go through this video again and see what is important in orthopedic, for example. Like the first word Dr. Rohit told, cold orthopedics, bone tumors are 100% important. Last time also we got 2 questions or 3 maybe like that. Out of ENT, what is actually required, if I may say, if I am preparing ENT, in the last thing I will never miss laryngomalacia, cancer larynx, tracheostomy, foreign bodies, all foreign bodies, larynx, nose, esophagus, foreign body trachea, every foreign body is mandated to foreign body bronchus also. Lateral wall of nose anatomy is absolutely required. Ethmoid air cells should not be missed by anyone. Nasal masses, 3 masses, rhinosporidiosis, enteroconal polyp, inverted papilloma or ringlet's tumor should not be missed. Glue ear is a must topic to be done. Inner ear anatomy to be completely revised. Every time one question out of inner ear. Sometimes ear only gives one question, that's inner ear only. Then adenoid, every time one question, you know it. Angiofibroma, nasopharyngeal carcinoma, tonsil and tonsillectomy, and lastly quinsy. This is like what I would say the high yield topics of the various arenas of ENT which you should be doing. I will just like finish my thing with this, guys. Just have this hope of passing the examination within you intact till the last second of exam is over. You think that you need to be ideally prepared for the examination, but as Gayatri ma'am also very nicely said, that nobody knows 100% about 100% about, like OBGY, ENT, even we don't know 100%, man. Let me honestly accept it. But still, what, if you actually have the right mindset in the last 1 week and on the exam you deliver properly, we'll try to come again, just a day or 2 days before the exam. So the last day strategy also, how to really cope up the examination also. But just keep this, hope alive within you. Keep this prayer very much alive within your heart that may I pass, may my friends also pass the examination. Thank you very much. And I will ask Sandeep sir to share his, hidden secret about pediatrics. That what are the topics he would like us to cover for pediatrics?
Thank you so much, sir. Thank you for such an beautiful insight into the subject and general, approach and motivation for the students also. So, before I start with pediatrics, there are a few things I want to emphasize, which are some of you have asked in the comment section also. Number one, some of the faculty members are missing. Yes, Azam sir, Raja Mahindran sir, Surgery, Nilesh Raj sir, Nilesh Chandra sir, and Shivani ma'am, they are missing. They had prior commitments. Some were stuck in traffic. Some are traveling right now, so they were unable to join. They have messaged us already that whatever important topics and suggestions are from their end, we will be posting them separately also, and we will be putting them as pinned comment in this video once it goes up on the YouTube channel. So don't worry, you will not miss out on any particular subject, even if the faculty is right now not visible to you. We hope that before the session ends, these faculty members are able to join us. Otherwise, we will put it up. First thing. Second thing, about my own subject. See, pediatrics, if you look at the papers, if you look at the last 2 papers, there were 2 questions asked in paper A also. They were more of overlap thing with physiology as well as with pathology, but majorly it comes in part number 2. Now, what are the areas you should focus? If you are weak in pediatrics, you must not miss them. Nutritional indices, weight for height for age, asked 3 times in the last 5 papers. So good likelihood of being asked. Second is severe acute malnutrition, Kwashiorkor versus Marasmus, including management part. There has not been a single paper in the last 10 papers where it has not been asked. So prepare the topic thoroughly. Third topic, January 23 question was asked. July, it was not asked. Who knows, January 24, it may be asked. Topic is short stature. Focus on not only the causes, but also the relation between chronological age, height age. Fourthly, congenital infection. There is always one question on congenital infection. It can come from OBG part, it can come from pediatrics part, sometimes it can come from the microbiology part. Another area is Trisomies, Down syndrome 100% आएगा, किसी ना किसी format में it will surely come. Also try to read the other important syndromes like Edward, Patau, Williams, Klinefelter, Turner syndrome. Another area is pneumonia diagnosis. I keep saying pneumonia guidelines have changed. I repeat it again. Pneumonia guideline change हो गया है. तो अगर पुराना पढ़ रहे हो, guidebook based if you are reading, please update yourself. Question was asked in every single exam. इस बार का IICT में भी आया. इस बार का NEET PG delay हुआ है, but it's a sure topic for NEET PG also and for FMG also. Apart from that, be thorough with congenital hypertrophic pyloric stenosis, diarrhea, management, as well as uh, the classification part, neonatal resuscitation, neonatal jaundice, congenital heart diseases. You can't read everything. Just go through what syndrome has what congenital heart disease, and please read about ASD, VSD, PDA, tetralogy of Fallot. 4 diseases if you can't read everything. Lastly, in neurology part, please be thorough with meningitis. Meningitis, sometimes 4 questions have been asked in a single FMG paper, ranging from etiology to clinical feature to CSF findings to management. तो meningitis adult बच्चों का similar होता है, वो table you just revise it, and apart from that, if time permits, febrile seizure and 3 pediatric epilepsies, infantile spasm, absence seizures, and juvenile myoclonic epilepsy. I think 50% pediatrics should be from this. If more things are asked, obviously, it will be a atypical paper, but close to the exam, if you read them, you will have that confidence before going for the exam. So this is from my end, and at the same time, there are some queries, specific faculty queries which have been asked very quickly. I will be going to the other relevant faculties and asking about it. One of you have asked, sir, this is my 3rd attempt, and I'm putting myself, I'm forgetting everything. My dear friend, every exam is different, and I'm a very movie person. I'm a very dramatic person. So movie है Doctor Strange का Marvel Cinematic Universe. उसमें उसने पूछा है, there is a dialogue there. Do you know what is the greatest gift one can receive? The greatest gift you can receive is having a second chance in life. It is not second chance or third chance. You are getting a chance to redeem yourself. Make use of it, and every battle is a new battle. Fight as if your life depends on it. So ho jayega, just give your best shot over the next 7 days. Apart from it,
Sir, I'm also, sir, just interrupting you. I'm
yes, yes.
also a movie person, and I refer to a very recent movie, 12th Fail.
Yes, yes,
So,
yes.
yes, Cafe Restart, it's all, about grabbing the opportunity that you get. You should be thankful that you have this exam right in front of you and you have prepared well to be able to clear it. So, don't see it as a challenge, see it as an opportunity. 7 दिन है, जितनी पढ़ाई करके इस opportunity को grab कर सकते हो, कर लो. Don't worry about your attempt number. That is not important. Not now.
Great, ma'am. Great input from ma'am. तो 12th pass अभी नहीं देखना है. अगर नहीं देखा है तो watch it after 20th paper. उसके बाद देखना है, बहुत time मिले. So don't watch it right now. Ma'am, please give the disclaimer also.
Yeah.
So a few suggestions, a few questions which are faculty specific, which have been asked. One of them is in big subjects, I feel like I'm forgetting everything. Rahul Rajiv sir, your comments, because your subject is technically the biggest one among all subjects in FMG.
So what I would just quickly advise the students is, see, it's not possible to revise A to Z. Just focus on the areas that you're likely to forget. You know what your weak areas are. Suppose you're weak in the topic of arrhythmias. You're weak in the topic of antiarrhythmic drugs. In the last 1 week, please go through those areas because you're more likely to remember it. So rather than going for a to Z revision, just go through these high-yield topics and just brush through them. As one of the faculties had pointed out earlier as well, see, in such an exam, you will remember the answer when it comes to the exam hall. Okay, so it's not that, you will not be able to think of everything at one point of time. And yes, this, that, but yes, there will be certain areas where you are slightly shaky. Just go through those areas and revise so that the probability that you answer will be more near the exam. So the message is focus on those areas that you are weak at. Okay.
Vandana ma'am, image-based questions students are asking. How much we should be looking at them?
First thing is, do not think that you will be knowing all the images. ठीक है? Image देखकर समझना is a very tough task. You know, even I understood it after I passed my exam. So remember, history is the most important clue. Okay, so take a history. History को पढ़ो अच्छे से. History में आधे से ज़्यादा आंसर होता है. ठीक है? History और options also come from the area जहाँ से क्वेश्चन होता है. ठीक है? तो always look at the history and the options and then try to analyze कि ये कहीं देखी थी क्या मैंने, बट हाँ ये हो सकता है, ये इमेज में क्या दिख रहा है. कुछ तो बहुत स्टैट इमेजेस होती हैं, जैसे कि क्रिप्टो आता ही है, या हिस्टोप्लाज्मा, या एलडी बॉडी, या फंगल हाइफे. सो देयर आर फ्यू इमेजेस व्हिच यू शुड always revise, and you should have मतलब एक basically you should just quickly go through those images. So कि कौन सी images आ सकती हैं, most important. Okay, so even in the DocTutorials, if you look at the app, there will be a lot of compiled images कि क्या क्या आ सकता है. So there are few images which you should know, but don't have very high expectation of yourself कि image देखते मुझे सब समझ में आ जाए. ऐसा नहीं होता है. Most of the time histories are going to help. कुछ images जो आपसे पूछी जाती हैं वो you should know, like वैक्यूटेनर्स. अगर वैक्यूटेनर्स का कलर आ रहा है तो वो आना ही चाहिए, वो आपसे पूछा ही जाएगा. ठीक है? फंगल हाइफे आ रहे हैं, एस्परजिलस और म्यूकर को डिफरेंशिएट करना आना ही चाहिए, वो पूछा ही जाएगा. बट कोई बहुत हाई फाई इमेज नहीं आएगी, कोई बहुत हाई फाई क्वेश्चन नहीं आएगा, मोस्ट पब्लिक. ओके, कीप योर फिंगर्स क्रॉस्ड. एंड अगर कोई ऐसा क्वेश्चन आ जाता है कभी, तो वो किसी को भी नहीं आता होगा. यू विल नॉट बी द यूनिक वन. ओके, so remember, RS cells आपको आने चाहिए. So there are very stat images which you should know. And in this chat box itself, I'll write some of the important image-based questions जो आ सकते हैं, जो आपको आने चाहिए, so that you can just revise those images. So immediately after this, in the chat box itself, I'll write most important images that can be asked in pathology, so that can help you.
Thank you so much, ma'am. Naveen Porwal sir, I think sir is here. Naveen sir.
Yes, sir.
सर स्टूडेंट्स के मैसेज आए हैं अलग अलग टाइम पे, सिमिलर हैं. एक ने बोला मैंने फिजियोलॉजी नहीं पढ़ा है, दूसरा बोल रहा है फिजियोलॉजी सुपरफिशियली पढ़ा है, एंड व्हाट टू डू सर. आई थिंक सर हैज ऑलरेडी शेयर्ड सम टॉपिक्स. सर, एनीथिंग एल्स यू वांट टू ऐड टू समवन लाइक दिस?
So for that, I think 5-year MCQs are, because topics already I have shared. I have got almost all the topics from last 10 years. So even if they revise those topics and 5-year MCQ for FMG, that will be sufficient, sir.
Great, sir. And sir, JP sir, what IPCs to focus on? A lot of students are asking again and again. Sir, in 2 lines, if you can summarize, sir.
Yeah, some people are asking whether IPC is important. I already told the basic IPC, like IPC section 44, 375, 319, 320, 416. Also, only, especially then 193, 191, that is regarding perjury. For FMG, they don't ask frequently about IPC. Only very, very important. That's all. Nothing much to worry about that.
Thank you so much, sir.
Thank you.
Thank you, sir. Khalil sir, again, students have asked about importance of paper 1 versus paper 2. Which is more important? Like, it's obviously a debatable thing, but you have been an expert in the field. Sir, your views on this?
I would say, the exam pattern will be mixed. If the paper 1 is easier usually, so paper 2 students find it difficult, or if paper 1 is difficult, the paper 2 is easier. But overall, the average would be mostly I feel would be a moderate paper this time. So need not worry on that, because many times the students know the topic, they'll mark it correctly also, but because it's not the exact words that they have heard and stuff, the anxiety will be there. So do not be panicked about that, and just be calm during your exam. Just the topics will be the same topics. You have done so much of work, all the classes, all the efforts that you have done, all the videos that you have watched, all of it will have covered most of the important topics. So topics will be the same, just the terminology will be different. Have faith in that. Har cheez naya nahi rahega. Everything will not be new on the day of exam. Have trust, and hopefully that would be a doable exam. One more important thing, that topic that I would want to stress is on eFast and FAST in radiology that I missed out. Please do that protocol of focused assessment with sonology for trauma. Please do that properly, eFast and FAST for the radiology part. So emergencies and the radiology part. Paper 1, paper 2, either of it will be difficult. If one is difficult, the other will definitely be easier. Last exam also, paper 1 was difficult, but paper 2 was pretty much doable. So have faith, it should be fine in the end. Yes.
Naveen, thank you so much, sir. Khalil sir. Nadeem sir, couple of students have said बहुत anxiety हो रहा है. One of them said clonazepam लेना पड़ेगा. Sir, your views. This is a very tricky area. Your comments on this, sir.
Okay, first of all, my humble suggestion. सबसे ज्यादा जो मुझे क्वेश्चन होता है ना सर, मेरे क्लास के बाद सबसे ज्यादा लोग जो है वो ड्रग एब्यूजर्स पैदा होते हैं. सबसे पहले वो सीखते हैं बेंजोडाइजेपिन कब यूज करना है, मोडाफिनिल कब यूज करना है, नहीं यूज करना है. आंसर इज नहीं यूज करना है. आप पेशेंट थोड़े नो. So my humble suggestion, on the day of exam, please don't use any psychiatric medication. जो सब लोगों को लगता है बीटा ब्लॉक है सर, जो आपने पढ़ाया था एंटी एंजाइटी ड्रग है, साथ में मतलब ये परफॉर्मेंस ड्रग है. मैं क्लास में बता दूं सर, मेडिकेशंस है ना, सेमिनार अटेंड करने से पहले एक प्रोपेनॉल ले लेते हैं वो, है ना. तो स्टूडेंट्स कुछ लोग क्या करते हैं, सेम डे ऑफ एग्जाम दे टेक प्रोपेनॉल. सुबह में हाइपोटेंशन आ गया तो अगर यूज भी करना चोरी छुपे तो एक हफ्ता पहले चेक करो तुम्हारा बॉडी कैसे रिस्पॉन्ड कर रहा है, प्लीज. बट माय हम्बल सजेशन, प्लीज डोंट यूज. ज्यादा से ज्यादा अगर यूज करना तो सिट्रिजिन विल बी फाइन. ठीक है, ओके फाइन. अपार्ट फ्रॉम दैट, अगर एक्सट्रीम हुआ देन यू कैन कॉन्टैक्ट मी पर्सनली. ऑलराइट. The most important thing which I should be emphasizing on, sir, like regarding exam, the most important medicine for everyone, please start improving your sleep cycle. Sleep is the best medicine as of now. आज से ही try करो. Please start sleeping by 9 to 10 p.m. Okay, and one night before the exam, latest by 9 p.m. please. 9 p.m. पे बेड पे जाओगे, 10 बजे तक सो जाओगे. You have to get up by 5 a.m. because remember, exam is not only of 5 hours. Exam 12 घंटे के लिए. Exam will be of मतलब see here, in the morning you have to get up by 5. You have to reach the center by 7 o'clock because at this center they will be spending 1 hour for pura verification and all, signature, your fingerprinting and all, right now. So you have to get up by 5, exam center latest by 7 you have to reach. By 9 exam will be started and exam will be up to 4:30. So see here, since morning 5 to evening 5 you have to store that kind of energy. So क्या, best sleep, healthiest food, non spicy, no fat should be there. ठीक है. उसके बाद से one night before please check all the documents. Last time paper was very difficult. This time we are expecting moderate paper. ठीक है. So recheck the documents, ID card, hall ticket, and in the examination room, see the kind of energy what you are going to have at question number 1. Same energy you have to maintain up to the last question. ठीक है. See in between, suppose if you are getting 5 difficult questions, उसमें थोड़ा panic attack आना शुरू, जो उसमें आना शुरू हो जाए, oh my god I'm not able to solve, don't get panic please. शोएब अख्तर के 6 balls आएंगे, fast आएंगे, बीच में कुछ तो easy आएगा. Please remember, 200 questions will be doable. Students do not fail because they are doing mistake in the difficult questions. Students get failed because they are doing mistake in the easy questions. 200 questions will be doable. 50 questions will be difficult. Last 50 questions जो होते हैं वो बहुत most difficult होते हैं. Last 50 questions are there only for examiner, for ego satisfaction. So please don't fight for all. जितने 100 क्वेश्चन के लिए नहीं करने पूरे, ऑल है ना, जितने 100% के लिए. So please remember, 200 questions will be doable. ठीक है. And during interval, please do not discuss anything with your friends. वो पेपर 2 आपका बर्बाद कर सकता है, right? Fine. So I think this is all from my side, sir, and I wish everyone the best of luck.
Sir, if I were a student, I would have gotten very happy listening to you right now.
That is why I am saying again and again, all the students listening to this, इसको mark कर लो. Exam में जाने से पहले एक बार सुन लेना whatever Nadeem sir has said, so that you calm down and don't take all these medicines. Regarding caffeine, I would answer this because I have suffered because of this. In my MBBS, I took a lot of caffeine tablets along with taking those shots of double shot espresso. In the exam hall, I barely passed only because I forgot whatever was coming. I had bad tachycardia in the paper. All these caffeines, all these methyl xanthines टैकीकार्डिया करते हैं, सो भाई लोग प्लीज एवरीथिंग इन मॉडरेशन. इवन कैफीन, टू मच ऑफ कॉफी इज गोइंग टू कॉज यू एसिडिटी. यू आर गोइंग टू सिट एंटायर डे, बोथ पेपर्स इन द सेम डे. So please do not try to, fall for this trap. Just rest assured, question will come, answer will be there. All you have to do is identify. Now, FOMO हो रहा है, sir. FOMO expert Rajiv Dhawan sir. FOMO हो रहा है.
First of
क्या
all,
कर?
one thing I think somebody mentioned in the 300 people are watching it live actually. So
Yes.
the most important reason is that you know what, students are looking at the faculty members. Actually, they are living your life. Actually, you understand. We are also mentally living the last 1 week with you guys, as Nadeem sir said, how to set the sleep cycle, properly. Because you most important thing at this point is, guys, don't think that you are alone and you are the only one doing it. A lot of people have done it like this in the previous many sessions, and all these faculty members have stood by this side actually. So when we feel that that someone is there working with us, we always feel a little bit more supported, and that's what this session is mainly about. Regarding the fear of missing out, guys, Nadeem sir also said, and we also keep saying again and again and again, 1/3 of the paper is completely unknown actually. The topper in the NEET PG generally has 75 to 76% score. I'm not saying the percentile. The average score of that, how many question he marks right. Mean every fourth question of the paper, even the top knowledge person in the country does not know. Then why we should have this moral, ethical responsibility to know everything about everything? Don't worry about it. You know what? You think I know dermatology little lesser than somebody else, but you don't know that you know psychiatry a little better than somebody else. The combination will make you pass the midterm. Why should we keep on looking at negatives actually? See, the training of the brain in the last 1 week is about, okay, I'm not perfect, but I'm adequately prepared for the examination. मुझे याद नहीं आ रहा, I'm forgetting it. Most important problem. But you're forgetting one thing. You know what? You are closing your eyes and trying to recall all the important differences between ulcerative colitis versus Crohn's disease. Then you only remember 3 out of them. Then you get panicked. Oh my God. I remember 10 pointers and now only can recall 3 because you're remembering like with the closed eyes. Is the paper like this? Is the paper a subjective paper that you write differences between ulcerative colitis versus Crohn's disease? No. 4 points in front of you. You have to identify which is not true about the Crohn's disease. And I am pretty sure with this much revision and with this much focused mind, we'll be able to pinpoint, oh, skip lesions. You know what? That was something like that will come to your mind that, okay, that is more appropriate. This is what actually you have to tell it to yourself. This is not a subjective paper. It's objective. So, number one, I am forgetting. Don't worry. On the exam day, when you see it on the screen, at least 70% of things you will recall. 30% you will not recall. I can't tell you bluff over here. Okay? कुछ भूल भी जाएगा, कोई बात नहीं, हो जाता है. Number two, fear of missing out. कोई बात नहीं. If somebody knows something better than me, I also know something better than that person. It's okay. And anyway, FMG examination, the most beautiful exam on the planet. There's no competition with it. Wow. Anybody who score 165 or above is equal for me. You score 165 or you score 232. You are absolutely same for the system, for everyone. You are not going to write outside your house, pass the MCA exam with 232 marks. Patient only knows what you treat it, how you treat it. That's all. Okay? So have faith. Who is asking you to be perfect over here? Enjoy the beauty of this paper without negative marking. 150 out of 300 is a doable task. I'm not saying easy task, it's a doable task. And your presence of mind, you are maintaining the hope within you is going to certainly help you in the paper. Okay, and we'll definitely come back 1 or 2 days like before examination to give you the strategy for the last D-Day, the 20th January day. We'll share that how we would have performed the paper on that day, and let's the last pep up session kind of thing. Okay.
Aptly said, sir. So all the students who are listening to this, we will try our best that 1 or 2 days before we come, repeat nahi karenge whatever we have told you. We have told you about the subjects and general queries we have taken. We'll be telling you things to do, things not to do, and exam marking strategy. So अपना 30 minutes निकाल लेना in case if you can, it is possible. So we will all come and talk about that, and all the remaining doubts we'll be taking there. because there will be individual doubts. You can always, whatever faculty you are fond of and in connection with, you can always message them and they will try our best. So before we finish off the session, I'll invite all the faculty members one by one sentence before we finish off the session for the students in their subject. We'll be starting with Rohit sir, orthopedics. Sir, your comments before we finish off.
I just wanted to tell all my students just to the exam hall with a clear mind. Don't panic. Everything that you have learned will help you to answer all the questions. There may be few difficult questions. Don't worry about that. Sometimes what happens is that the first 10-20 questions would be difficult and then the person would get flustered. But that is not what we want. Even if the first few questions are difficult, sure that the subsequent questions will be easy. So don't get flustered, be confident, and all the best.
Thank you, sir. Naveen Porwal, sir.
Yes, sir.
Sir,
All the very best to all my
parting
family.
comments.
Just all the very best to all of you. We'll meet you very soon.
Yes. Thank you, sir. Vandana ma'am. Ma'am, your parting comments.
All the very best everyone. First, बस इतना याद रखो, you know everything. तुम्हें सब आता है, and everyone is going to pass. So that's the only thing I'll tell you. Everybody is going to pass. So go with an open mind and you will do best.
Thank
All
you
the
so
very
much.
best.
Thank you, ma'am. JP sir, in your style, anything before you?
Nothing like that, no style. I can only say like all others, all the best. We all wish everybody all the best. Be cool. That's all.
Thank
Bye-bye.
you so much. Thank you, sir. Rahul Rajiv sir, sir, your parting comments.
Yeah, all the best to everyone. Believe in yourself, believe in your faculties, believe in the resource that you have. No need of any FOMO at this time. Just trust yourself. You will do good. Thank you so much.
Thank you, Rajiv sir. Ashish sir, sir, your parting comments.
Dear friends, it's very simple. Please look into the previous year's questions before the exam. Find some time for that. That's what essentially all faculty is trying to tell you. And you should be very happy and lucky to have so many great people from a reputed organization trying to help you out, finding out their time. It's a great and pleasure to help you. Thank you once again and all the best for you. Thank you.
Thank you so much, sir. Khalil sir, sir, your parting comment.
Yeah, all the best, all of you, and don't give up. You are in pursuit of success, so all kind of challenges and pressures would be there. But when you are in pursuit of success, have faith, and definitely there is a lot that you have accomplished so far. And going forward also, if just see that you give a good ending to all the effort that you have started. You started with so much of enthusiasm. Focus on this 1 week, that this week should be a good ending to all the efforts that you have started. All the best from my side, and have a great exam, and we'll all be proud to see you successful on the other day. Okay, all
Thank
the
you so
best.
much, sir. Thank you so much, sir. Pallavi ma'am.
All the best, everyone. As Dr. Khalil said, all the culmination of your months and months of hard work into this 1 week, then into that 1 day of the exam. तुमने सब पढ़ा हुआ है, तुम्हें सब आता है, तुम्हें बस जाके उसको सही मार्क करना है. इस हफ्ते में अगर लगता भी है रिवाइज करते हुए कि मुझे कुछ याद नहीं है, it doesn't matter. Pages turn करते रहो, देखते रहो, एग्जाम में सब याद आ जाएगा. ठीक है? All the best. All the best.
Thank you, ma'am. Gayatri ma'am, your parting comments, ma'am. Ma'am, your mic, please.
All the very best for the best of luck for the exams. So be calm, be confident, and believe in yourself, and keep on revising. And this week is very important. Keep on revising. All the very best. See you on the other side soon.
Thank you so much, ma'am. Nadeem sir.
Yeah, I want to tell everyone that athletes do extra push-ups in the last days of training. So the 7 days should be the most aggressive one. It should be here now. You are going to show the maximum level of your energy. Work like a labor. Mazdoor ki tarah kaam ab shuru karo. 7 days. You can turn the table around. I'm telling you, seriously. So maximum energy, maximum work you are going to put right now. You can turn the table around. Remember it. You are going to make history. I wish you everyone all the best. Thank you so much.
Thank you so much, sir. Taking off from what Nadeem sir said, there is also a query. Should we solve mock test in the end? Last 72 hours before the exam, no more mock test. Only previous year questions. Stay away from grand test, mock test, everything. PYQs, important topics, multiple revisions, untouched areas, just try to focus, right? Time for all the mock exams last 1 week. That is not the time. Rajiv, sir, your parting comments, sir.
I would like to, especially say something with the repeat students because they have got another kind of pressure on them. I will just say that don't anticipate the same thing will happen this time also. जो पिछली बार हुआ वो इस बार नहीं होगा. डॉक्टर संदीप ने बोला हर एग्जाम डिफरेंट एग्जाम होता है और जनरली आप ये अप्रोच लेके जाओ कि इस बार जो लास्ट टाइम गलतियां करी थी वो इस बार नहीं करेंगे. रिपीटर मींस व्हाट? मोर वाइजर. I will not repeat the same mistakes as I did last time. Time management was a problem last time. We will not do all those things and we will be, comfortably passing the examination. So to all the people who are freshers, just let's make it the first skill only. And to people who are repeating, just do not anticipate the same thing can happen again and again. I understand that pressure, but just pray that may I pass the exam this time. This is another exam. I prepared also more. I know where I was wrong last time. I will not do the same mistake this time. And with the God's grace, with the parents' blessing, I'll pass the examination. Okay. Thank you very much, everyone. Just stay in the upbeat and like momentum should not be broken in the last 1 week. As Dr. Nadeem also told, that Khalil sir also told that we should now pick up the speed and really, touch upon the most important points of all subjects one by one. And that's what is required at this moment.
A movie is a blockbuster only when the climax is good. तो अभी last 7 days Nadeem sir said अभी आ गया है. This is your movie, your life's journey. अभी make the climax so exhilarating. I don't know the English translation of this. For those who understand Hindi, गदर मचाना है, right? It literally translates to make the exam yours. 200 plus you should be targeting, and I hope we all hope all 19 subject experts here hope at DocTutorials that you all crack the exam and may you all spam us with your success messages after the exam is over. We all 19 of us will wait कि sir हो गया. That would be sufficient. We'll be raising the toast in person as well as on social media with all of you. So God bless everyone, and we'll be connecting again. We'll be coming again at 1 or 2 days before. This time it will be a shorter session, some exam marking strategy. So it will not be a repetition of what we said. And all the topics which have been discussed, we'll be compiling in the end. And all these subject experts like Azam sir, Shivani ma'am, and Rajamendran sir, and others who could not join us, we will be taking subject topics from them and posting it here in the comments. So thank you very much. Thank you all the experts here for taking out time for the students, and may God bless everyone. Thank you so much from DocTutorials team.
Thank you, everyone. Thank you.
Thank you, everyone. Thank you.
Best wishes.